and there's also more information about the program on our website. But what I thought I'd cover in our hour together today, or about an hour or so, have a look at why we do this, and then I'm going to share the approach we take at NHS Select and the program that we've developed with our trusted colleagues and partners, and just think a bit more about the approach. How do we know that change is an improvement in this space? What are teams trying, and how have teams found the program? So that's what I thought we'd cover. I'm going to use Slido a few times today just to get your views and test a few things out. If you've not used Slido before, the easiest way to do that is just to grab your mobile phone and hover over that QR code. If you open your camera on your phone, hover over the QR code, it should take you into a Slido. And just a question to kick us off, how's your day going so far on a scale of 1 to 7? I'd really value if you could just hop onto that and answer that question for me. Or if that's not working for you, open another tab in your browser, go to slido.com, and it will ask you for a code, and our code is happy2 today. So let's just see how we're doing today. There we go. There's a few of us at 7, a 6, a 5, and a 4. Where are you, Anita? Anita's on the spot.
I think today I am a 7 because I've had a good morning so far.
Fantastic. And it's early in the week, isn't it? So
early in the week, yeah.
Plenty energized. All right, a few of us got a few more of those coming up. We're just going to test some things out. So it'd be really cool if you can join us on that. So why be happier? That sounds a little bit fluffy, really, doesn't it? We've got busy, important jobs to do. We've got patients to see. We've got waiting lists to get down. We've got a whole load of stuff going on. Actually being happy as well might feel like a step too far. Well, there's a growing body of evidence around why this really matters. And it was one of the forefathers of QI, Dr. Edwards Deming, who first coined the phrase, people are entitled to joy in work. And this is where a lot of this work now stems from, really. But the evidence for this approach is growing and growing and growing and becoming increasingly powerful. So we know that companies with happy employees outperform the competition by 20%. Happy employees are 12% more productive. Employees who report being happy at work take 10 times fewer sick days. So we're more productive. We take less time off sick. And here's a big one. Employee satisfaction directly correlates with safer and efficient patient care. So not only are we less sick, we're more productive, we're actually better at what we do. We're more efficient, and we're safer. And the work of Michael West, who's now the King's Fund, starting to show, these really strong links between the NHS, staff well-being and engagement and safe, effective patient care. So this isn't just fluffy stuff. This isn't just about making people happy and smiley as they go about their day-to-day jobs. This is hard stuff. Makes us more productive. We're going to reduce sickness, but importantly, it's going to make things safer and better. Another piece of research from Gallup here is 70% fewer safety incidents where staff are reported to be happy and engaged. This is big stuff. And here's the other big one. This is from this King's Fund work, that fewer patients die. I said that correctly, if hospital staff are happy and engaged. So this isn't just a nice to have. This isn't just about being sort of lovely and fluffy and cuddly and warm and wanting all our staff to be happy. We know the evidence says we will be safer and we will be better at delivering it. It's a big longitudinal study of 10,000 civil servants as well that shows that where people have control over what they get up to, an opportunity for social participation at work, it profoundly affects the health of individuals. So not only will we deliver better, safer, more efficient care, we're also going to look after ourselves and we're going to be healthier as well. So why wouldn't you want to do some work in this space? And probably over the last few years, we've seen an increasing number of initiatives happening across healthcare and across social care in this space. One of them, probably things like wellness sessions and well-being and mindfulness and yoga sessions. And whenever I hear about those, I'm always reminded of this lovely little graphic which I came across on Twitter, or X as we're now meant to call it, by Twisted Doodles. And I think this just sums up sometimes how we get it so wrong. When people are completely burnt out, yoga probably isn't the starting point for this. And that's often where people go when we start saying we want to work with your team around creating happiness at work or making for happy working lives. They think we're going to come straight in and start doing yoga sessions and mindfulness and relaxed breathing and all those sorts of things. And that might be right for some teams, but for an awful lot of teams, it really isn't the right place to start. And you could discover actually could have a negative impact, a bad consequence, and actually have the exact opposite effect of what you're hoping to achieve. So let me share a bit about our approach that we've been getting up to and we've been testing. And where we started this is with the IHI, Institute of Healthcare Improvement, and their Joy in Work framework. And some of you may be familiar with this. There's some really good resources online about this. And this was the program for the Institute around Joy in Work. And we started our program using the word joy, and when we were sharing this with organizations talking about joy. But what we discovered was that seemed to generate a few antibodies with some people, and we tested out these words, said, hey, if we were going to do a joy in work program, and people go sort of groan inwardly and say it just doesn't quite feel the right word for a lot of teams. I'm not saying it's not the right word, but when we tested it, a lot of people were a little bit uncomfortable with this concept of joy, because they associate joy with sort of laughter and, larking around and all those things. When you dig deeper, that's not what this is about in any way, shape, or form. But we didn't want to start a program with people already being a bit like, oh, what's this all about? Now I've got to be joyful as well. So that's why we've called it Happier Working Lives. And what we're saying there is our aim is for teams and individuals that come along to our program is to make their working life happier. We're not saying it's going to be blissfully happy all the time, but we hope if you're thoroughly miserable at the moment, we hope the program will shift you a little bit along that continuum to be happier. An alternative name for the program would have been how to be less miserable at work, or words to that effect, but we didn't quite think that had the same appeal. So that's where Happy Working Lives came from. The model proposed by the IHI is really helpful, and you can see there's lots that contribute to the center of that model there, that happy, healthy, productive people. And there's a whole load of things around there that individuals can do, managers and core leaders can do, and senior leaders can do. So a lot of what we do is building on that. But what we also know is one size doesn't fit all. Getting this right for the team, for the context, for the organization and the individuals is key. So we know what works in various organizations and we've got loads of ideas, but what's really important, just because something's worked down the road and they found this approach really helps their team, doesn't mean it's right for your team or the team that you're working with. So we really stress this point. There isn't a one size fits all. And we also come at this from a team angle, not an individual angle. And that's important. And I think that's really important because resilience doesn't just lie in individuals, although we do have some resilience in us. It also lies between us. So teams can support each other through the difficult times and celebrate the good times. So being part of a good cohesive team helps with that concept of resilience. And again, we've seen lots of courses emerging where people are sent on resilience training, which almost blames the individual a little bit. The reason you're not coping very well or you're getting stressed is because you are not resilient. Therefore, we're going to train you how to be resilient. I'm not dissing resilience training. There's some really great stuff that goes on there. This approach takes it more as a team. How can we approach this as a team and take everybody with us? So we talk about the Happier Working Lives journey, and this is a sort of graphic summarizing it, I suppose, really. And it is a journey. There isn't one size fits all. There's no quick fixes on this. It's walking that path is what yields results. So you can see there it starts on the left with that building the team, getting the right people together to talk about these things. Then having this WMTY, that stands for what matters to you, a conversation across the team with the team about what matters to them at work, what lights them up, what brings them in, what brings them happiness in their work and their working day. And that leads us to this next bit, really, of identifying the pebbles and the boulders and the bright spots or the bright sparks. So pebbles and boulders, the stone in your shoe analogy. You're a little stone in your shoe. It's kind of super irritating and you think you can keep walking on, but actually at some point you have to give in and take your shoe off and tip that tiniest little pebble or grain of sand, it sometimes looks like, out. But it's those little things that add up. They can make a journey feel harder work. Those little nags and niggles at work can really zap our energy and our strength in the working day. So we encourage teams to look for those, but also to look for the boulders, the bigger things, those organizational wide things or team things that are impeding a good or happy day, but also focusing on the bright spots, the what's good, what lights us up, which bits do we need to work with, what bits do we need to keep, and then leading on in our journey. How are we going to measure some of this? Can't do quality improvement without having some degree of measure, so we know that things are improving. We help teams explore what could work and test out those ideas. And throughout our program, working with teams, we're always chipping in ideas from elsewhere, not to say these are ideas and you must do them, but to say here's some things other people have tried. Could they work for you? Would it be, is there something in this that might be helpful and useful? But it's really important that teams come up with what they want to do themselves and maybe get inspiration from elsewhere. But there isn't a sort of, you must do this and you're going to be happier. And we also work with teams to provide them some coaching, mentoring support just to help guide them through their journey. Really happy to take questions as we go. If that's helpful, just pop them in the chat and I will try and keep an eye on things. So here we go. If you're in the quality improvement space, I'm hoping you're going to recognize that model. It's not nothing new. It's been around a while. It is, of course, a model for improvement. Those 3 simple questions in that cycle. And this is the approach we've taken for our Happier Working Lives program. And that's what's quite exciting for me. It's around teaching and upskilling people with QI, sharing our QI tools and techniques and approaches, but rather than applying it to a service area or a service development area, looking at our team. So it's a really nice way of introducing a broad, wide team to the concepts of quality improvement. And the hope is then that they can go on and use that to solve other issues and challenges wider than just themselves. So those 3 questions, that aim, what are they trying to accomplish? We get teams to really reflect on why are they doing this? What might the benefits be? What are they hoping to achieve by creating happier working lives? And you saw some of that evidence that I've shared with you, but it's good that teams spend some time really reflecting on what that will mean for them. Then we start thinking about how do we know that change and improvement? How are we going to measure this? How can we measure happiness? How can we measure happiness at work? Feels like quite a difficult thing to pin down, and we can maybe do some surveys and There's some really simple approaches which I will share some of the things that we get up to in this space. But again, it's teams to decide what will work best for them. And then I think the really fun part of any QI is developing theories of change and coming up with ideas to test. And we use the PDSA cycle for teams to start testing what works for them. And if they test something and it doesn't go down well, say they want to try a new weekly team huddle and they try it and it's a disaster and everyone hates it, we try and celebrate that little bit of failure because that's really good learning. That just because it works somewhere else, we've now learned actually that's not right for us, that's not right for our team, that's not right for our context. We might push them to try a few other iterations of it, but generally celebrating those failures as well is really, really key. So I thought for the sort of remainder of this session, really, I'll go through what I think are the four key lessons from the program. And as we said, I'll absolutely share these slides. Helping people get started is really key. As I said, often teams will come on this program or working with us, I just go, oh, what is this all about? We've got enough work on already, and you've got a bit of angst around it, and they always associate it with, we're going to have yoga sessions or mindfulness or, laughter yoga or whatever it is. So I thought I'd ask you really quickly just to see, and I'm not tying you to any answers here. Would a weekly work yoga session make you happier at work? Don't hold back. Would that make you happier at work? Yes, maybe, probably not. No. Let's see where we are. Oh dear. There we go. There's someone who said yes. Generally, probably not. Yeah, probably not. And a few no's and a maybe, and then maybe one or two of us saying yes there. And there isn't one size fits all, as I've repeatedly said. But often when we start thinking about how can we improve wellness and happiness at work, the great and the good will come up with some ideas, and they say this is what we're going to do. And the key with taking a QI approach is that the teams start to understand what matters to them and then start to build ideas into their daily working practice that will make them happier. If yoga is the right solution for a team, knock yourselves out. Go and buy some mats and sit on mats and get yourself into odd poses as much as you like. But for a lot of people, it's not the answer. And that takes me back to this, this one size doesn't fit all. So getting people started on this starts with this, a good what matters to you conversation, getting people to sit down with colleagues in their team and start just having some of these chats, really. And we share a structure of how to do this, but it's really not difficult. A small 30-minute gathering of, what makes for a good day, what gets in the way of a good day, what lights you up, what do you enjoy doing, what first brought you into this profession, and just sometimes reconnecting people with a bit of purpose. Why have we ended up here? Why are we doing this? And I always say to teams, if you really want to get energized, go and interview or spend some time with people just coming into your professional field. Go and talk to some student physiotherapists or student nurses or student doctors who are enthusiastic and passionate about what they're coming into and wanting to make a difference and do things. And we might sit there going, oh, you poor deluded soul. It's not like that at all. But actually, we do an awful lot of good day in, day out. And what matters to you conversations can help people just reconnect with some of that and also help us learn about our colleagues, learn what matters to them in that work environment. And as I said, what you're trying to do here is start to that first bit of the quality improvement model, really, of diagnosing what's going on. So what are those pebbles? What are those little nags and niggles that get in the way of a good day? What are the bigger boulders? What are the things we might need to tackle at organization or system level or wider team level that's getting in the way of us having a good day? But also, what do we enjoy? When we look back and reflect on those good days, what made it a good day? What energized us? What brought us together? What lights us up? Those things. So we get this really balanced approach to looking at things. And I'm sharing this graphic. I share this graphic so many times, but I think it so nicely sums up this concept of appreciative inquiry. And you can see the two chaps there. There's one focusing on look at all the things we've got, and another one looking at look at what we're missing. And often when you start working with teams, they will very easily and naturally focus on all the things that are missing, that hole, that deficit. Oh, if only we haven't got this, we haven't got that, we haven't got enough staff, we haven't got enough pay, we haven't got enough car parking, we haven't got enough resources, we haven't got enough computers. Da, da, da. Absolutely, that's important for teams to look at, and we don't ignore it. but we also want to look at actually what have you got? Well, we work with loads of great people, really enjoy the people in my team. We have the privilege of working with an amazing patient group. We're part of a great organization. Whatever it is, start focusing on what you've got, not just what you're missing. How do we measure some of this was the big difficult QI question. How will we know a change is an improvement? We've got to measure something, and this all feels a little bit nebulous in a way. So the very simple data collection tool that we encourage our teams to do is this, a really simple end of day reflection. How has your day been? So the end of a shift or the end of a day, get teams, individuals to reflect and just say, was my day mostly good? Or was it mostly bad? And then in a few short words, this one says in 5 words, you might go 10 words or 15 words, but just in a few words, can you describe why that was? Why was it mostly bad or why was it mostly good? The reason you want to limit that is if you just say, tell us why, you can end up with War and Peace, which might be helpful, but it does make data collection analysis difficult. The way we do this with teams is we encourage them to do a data collection like this every day for a couple of weeks. And we've tended to find that's about as much as most teams can kind of tolerate. If you go over 2 weeks, yes, you get richer data. Yes, that really pleases the people that are making SPC charts, but the team get faintly exhausted by it and they stop completing it and it becomes a battle. But if anyone's cracked that, let me know. So we tend to say, do a couple of weeks of this, and that gives us a really good diagnostic. Then when we've tested some things, we'll repeat it and we'll do another week or two just to see how things are going. So I thought we'd try that. We'd do some real live data collection with us all, if that's all right. We use Slido. So just, how's your day so far? I know we're only halfway through the day, aren't we? So hopefully it's mostly good, but mostly good or mostly bad. Let's see where we go. Look at that. We're 100% mostly good, and a few chats coming in on the chat. If you want to get Slido, the easiest way to do it is just open the camera on your phone and hover over that QR code, and it should take you to the Slido poll. There we go. Look at that. 100% good. Our work is done. We should stop now before it turns into bad. Generally, what you'll see when you get your teams to do this or teams do this, it comes about 80% of people will report mostly good. And then 20% might say mostly bad. The key word here is mostly. If you just said good or bad, that's quite a hard binary choice to make, and people possibly would default to bad. Because actually, I don't want to say it was good, because it wasn't good. It was a lot of good bits. But doing this mostly good, mostly bad, we think makes it a more reflective question, and people review the data. And actually, you know what? On balance, it was pretty good. And actually, that's a key thing as well, like just reflecting at the end of the day. So if you said mostly good, which is most of us, give us a few words as to why, what's made it mostly good. Give us a few words on that. We'll see what comes in. Nice atmosphere in the office today. Woohoo, coffee with friends. Nicely busy and productive. Kind patients. Good meeting. Been productive. Feeling productive. Taking a break. Had some good productive conversations, and the sun is shining. Fantastic. See a common theme emerging? Productive. Yeah, we do actually like to be productive. Excellent patient visit, just got a brew. What's not to like? Engaging with colleagues with QI, fantastic. Some really good stuff. Generally, we like to be busy. We like to feel we're making a difference. We like to be productive. That is good. This is encouraging. Now, none of us had a mostly bad day on that poll. So we're not going to do that. If you said mostly bad, tell us why, because actually we've all had a good day. What you can then do with that data, and here's a lovely Pareto plot that one of the teams has done. You can start to see what is it that's contributing to a good day. And we saw that in our little poll there, that actually being productive matters. We want to feel that we're able to do things, and good teamwork, and people reported, team meetings and things. So you want to dig a bit deeper. What does that mean to be productive, and expand on that? And you can see what's going on there. Then the other really interesting bit is when you start looking at when people say they have a mostly bad day. Thankfully, this is a lot rarer, maximum 20%. I think the most challenged team we worked with sort of had 30% of colleagues saying they were having mostly bad days. And you can see what's going on here. So maybe unable to meet demand, that not being productive, just feeling swamped and sort of running around trying to keep up with things and failing. Yeah, exhausted, feeling run down, frustration with other members, too much admin, no lunch break, poorly completed referrals. The list goes on, and each team has its own little version of this. But what this now does, it gives us a shared language of what's making for a good day and what's making for a bad day. And hopefully, teams will have got most people to complete this. This is really, really powerful stuff. And from this, you can then start to build your change theory of change. You can start to look around for what ideas might make it better. If you're really keen collecting data, you can start plotting things over time. And here's a nice run chart of that good day measure over time. And they've annotated it to see the difference things started to make. And you can see when they introduced team huddles, that really improved the number of people saying they were having a mostly good day. It's still going to vary. That's what data does. You can see when they got stressed and staff went off sick due to sickness. Staff went off due to sickness, you can see it dip. So you can start to get a bit of a barometer of the mood over time. So that's that really, I think, simple approach to measurement. And some teams will do this with physical bits of paper, good day, bad day. Some will do it using MS forms and put diary invites at the end of the day and all sorts of things, and QR codes up as people leave the ward, etc., just to collect this data. And because I say we tend to encourage people to just do it for a couple of weeks, we seem to get quite good data completeness then. I love this, absolutely love this. This is a modified version of that Maslow's hierarchy of needs by the very talented Sonia Sparkles that shows we've got to get the basics right. And I'm always stressing this with people: start at the bottom and work up. So if you're working with a team, if they're not able to take lunch and tea breaks or have drinks, or it's too cold, or they can't get to the toilet, or they haven't got really balanced working hours, there's no point going in at the top and offering career development opportunities and all those sorts of things. You've got to get those basics right and move up. So thanks to Sonia for illustrating this for us, because I think it's absolutely fantastic, and I refer so many people to it. My second thing is how you start getting teams to test out ideas and changes. And often holding them back from testing is the hard thing, because they come with loads of ideas what they can do. But actually, you want people to do that diagnostic first. I'm sure if you've worked in QI, this will resonate with you. People want to race forward and start changing things, but we're going to need some way of measuring it. And we're going to need to get some good diagnostics done on the system to really understand what's going on. One of the things that lots of teams work on is creating connection between team members. Here's some of the pictures of some of our teams working together, coming up with intentional opportunities to build connection. We're inherently social beings. We tend to like being part of a team, being connected, being with other people. Not all the time. Some of us got different energy levels for that, but just helping teams create connection. Lovely piece of research. It's from the States, but it looks at firefighters who eat together, make better teams. They have better job performance than compared with firefighters who eat solo. So I'm not a firefighter, but I understand they will sort of often sit around a table like this and eat. This is in the States. But also you could just take your food off and go and sit in a corner and read your phone or whatever. But actually what they found is where those groups work, sit and eat together, they have better job performance. So can teams create opportunities just to sit and have a lunch together or a meal together? Not every day, that's probably not going to be practical, maybe once a week, or encouraging people from your unit to go off in 2s and 3s and have lunch together. And I just, people probably sat here going, just getting a lunch break is actually a bit of a victory most days. So completely understand that, but creating opportunities for people to eat together really makes a difference. Another thing that emerges time and time again, recognition and feedback. None of these are difficult things or shocking news, but just getting good recognition and feedback when we do something well. It reinforces that positive behavior. It boosts self-esteem. It helps people connect to meaning in their work. And managers and leaders can positively connect with the team. When most people hear the word feedback, they think it's going to be something negative. If I said, got some feedback for you, you think, oh Lord, what have I done wrong? Feedback is both positive and negative. And I think we should be looking to praise and reinforce people as much as we can with those positive things. And if you see something good, tell them. If you see someone doing something nice, it might just be dealing with a challenging phone call or helping a patient in the corridor or being kind to another colleague, whatever it is. If you see that, spot it, please do tell them. Doesn't have to be massively cheesy. You don't have to do it publicly. You can just go, really impressed with how you handled that really difficult phone call earlier today, or whatever it might be. Really helpful. And it sits with people as well, and it can change their whole day. One thing I'm trying to do more and more of is my first email of the day, I try to make it a thank you or a positive email. So I will sit down at my computer in the morning and I will maybe thank one of my team or someone I've worked with, and trying to give some nice specific feedback, what I've enjoyed about a session or what I enjoy about working with them. It makes me feel good, but I also know it lands really well as well. And often you'll get a nice email back. That's not the reason to do it. It's a nice byproduct. Loads of examples of this around the country. Here's from Newcastle, I believe. They have a board on their ward 12, where they just do a shout out, and they change this every month, of every team member gets a mention, and it's positive vibes. So it's just a nice way of keeping this on the surface for people. Whatever works for the teams. What I love about our Happy Working Lives work is it's taking this QI approach and applying it in the world of organizational development, really. As I said, it builds on the work of Joy in Work by the Institute for Healthcare Improvement, and you can see lots of things in there, and there's a growing body of evidence around this area. So I will happily point you to that. But this QI approach is really key because we're working with the team, we're involving the team. Everyone gets a voice, everyone is encouraged to partake, everyone's ideas and views should be listened to. It doesn't mean they're going to be implemented, but you're going to do this as a team. We encourage that measurement. We give people some simple tools to do this. Throughout the program, we will be teaching how to create a Pareto chart, how to look at a run chart or an SPC chart, how to collect data and how to analyze things. So those QI skills are starting to emerge. Maybe how to do a fishbone diagram, how to write an aim statement. So it's not QI by stealth because it's QI out there, but it's a really great way of getting teams to embrace QI and apply it to something really meaningful, and you can see quite quick results in team happiness. And we know this isn't just a fluffy thing, as I shared the evidence earlier. It delivers more productive care. We should start to see reductions in sickness. We then encourage people to look around for ideas, and importantly, testing things out with the team, finding out what works for them and their team. Just because something works somewhere else doesn't mean it's going to work in our context and our environment. And of course, PDSA testing. If you're not familiar with PDS testing, this really simple approach of small scale change. Doing something, planning what you're going to do, doing it for the shortest possible length of time you can get away with, and seeing if it did what you think it was going to do, and then acting on that, either adopting it, adapting it, or going, actually, do you know what, that was rubbish and we never want to do it again, and we would abandon it. And that's all really, really great and helpful learning. So that's PDSA. And when I say test for a small time, if you're going to do a team huddle, do one and then reflect on it. Don't do it for 3 months and then go, do you know what, that's awful, we don't like it. Or if you're going to try a new way of doing lunch breaks so people can go together, do it for a couple of days and just see how people found it and keep them involved, keep listening to their feedback. A really great way of testing things. But actually in this space, it really hammers home the powerfulness of small scale tested change with the team, because they're seeing that learning and they're giving their feedback in real time. Another great graphic, that really importance of doing this in small steps. So try to involve the whole team in something to start with, test it out with a few team members, and then build it and grow it. I'm not keeping a massive eye on the chat, but I think we're all right. So how the teams found this approach? Well, generally they've loved it. They've absolutely loved it. Here's some of the great teams we've been working with. Here's the feedback on the program. Yeah, it was amazing. Thank you. I love these ones, like the second one where it says, I was skeptical at the start, but I'm now fully signed up. There's one further on that says it was a bit like being on CBeebies. Yeah, down here a bit more. I didn't like the idea of this. It seemed unnecessary and initially a bit like being part of a CBeebies show, but I warmed to it. The concepts were good, well presented and applicable. Thank you for winning me over. It's those things. People come, they're cynical. You might start off with a whole load of grumpy faces and arms folded. But what we know, gently working with them, we can win them over and actually start to turn them around, because there is cynicism about this. And we know where that comes from and we know what it's like. I've been around the NHS for far too long, 25 plus years. So I know what our working culture is like, and it's easy to get cynical. It's easy to think these are just tick box exercises. But what's nice about this program, it takes it back to basics. It's about the team coming up with things. And then, so what the team's actually done. And here's some of the results. I think we've probably worked with over 100 teams now, which is just incredible. And lots of little simple things. So sharing daily positives in team chats, huddles, lots of huddles emerging, or just increased communication or initiatives to, build connection and dropping sessions, etc. Nothing groundbreaking, nothing that you couldn't probably come up with anyway. But actually what's important is the team have come up with this and they've decided what works for them. Other things that we see a lot, again, recognition and awards. And I showed you some examples of that. So the cherry on top award, that going the extra mile for one team, exceptional team members, shout outs, praise and thank you portals, ways of doing this, or just encouraging leaders and colleagues to do some of this informally. Doesn't have to be a big thing at a team meeting, just starting to gently shift that culture to, if I see something good, I'm going to tell them. If someone's done something great, I'm going to, drop them a little email or a note. If you can get people to handwrite cards, that makes a huge difference. So on our in-person program, we give people physical cards that they can pick and they write a thank you note or a I think you're awesome note to one of their colleagues. Sounds a bit cheesy, but it lands really well. Taking the time to handwrite something actually improves its value and its worth. If you get something handwritten like that, you will keep it. You might pin it up. It might be on your desk. If you get an email, that's good and it will land well. But something about effort now as well in our modern digital worlds where we can do a WhatsApp message so quickly, someone taking the time to write you a little note will really land, really stand out, and people will keep it. Lots in the well-being and morale space, so more well-being elements, actually just talking about these things, what matters to us, what gets in the way of a bad day. You can start to create this language in teams where people go, I had a mostly bad day because X. And actually doing that measure, mostly good, mostly bad, it's a lovely bit of self-reflection as well. So even if you're on your own and you're not in a team, I would still encourage you to maybe do that at the end of every day for a couple of weeks, and you will start to see a pattern. When I'm having a mostly good day, X, Y, and Z has happened. When I did it, what I discovered was if I'm on my own all day and I don't get to connect with any colleagues, I'm a little bit miserable. I might have been productive and got a lot done, but I do need a regular little coffee or a chat with one of my colleagues just to keep me energized and feeling engaged. So I know now when I have a day when I'm not connected with anyone, I will deliberately pick up the phone and talk to someone because that's the difference between a mostly bad and a mostly good day. So lots in that well-being and morale space, lunch breaks, getting people to do that, buddying schemes for new members of staff. How do we welcome and onboard people? Often there's a lovely checklist of all the competencies they need to have and how to do this and where to get your ID badge and how to log onto the system and all that. But actually, sometimes there's more informal support schemes of what's the culture? How do we do things by round here? What's the deal with this? So creating those buddying schemes really makes a huge difference. Development and training comes up a lot. We like to learn new things. We're generally keen to develop and grow. So creating those opportunities is key. And also autonomy is the other one that comes out loud and clear. So delegation, can we delegate more responsibilities to people so they can grow and develop and start to flourish? Lots in the social and team building activity space as well. No great surprises there. We've had all sorts of things going on from people going out for picnics and lunches, and again they're coming up with what's right for them. These are not right for everybody. What's right for them. Other things we see is just that creating a positive culture or changing the environment. So little improvements to workspaces. Some teams have worked together to improve their break room, not spending ridiculous amounts of money to do it, but just tidying up notice boards, clearing out cupboards, buying some new teaspoons and some new coffee cups. Those little things can make quite a difference. And if they own it, hopefully it will last. So as I said, I don't think any of this is rocket science. And this is really good basic quality improvement, taking that model for improvement and working through what are the teams hoping to do, how can we measure it, what changes they can come up with. But the key benefit of this, it's owned by the teams, and it's absolutely right for them. So what they come up with, they test and they see if it works for them. Most of those things that I've just shared with you that teams have done, we could have probably come up within a 5-minute brainstorm, and we could have just said, right, what you need to do is you need to have a huddle, you need to have lunch together, and you need to clean up your break room. If we tell people to do it, we'll get a whole load of resistance and it'll be difficult, and we'll tell, well, that won't work because da, da, da. When teams go through the process and they get there, we own it, we're going to make it happen. What we try and do is just steer that process, give them ideas from elsewhere to stimulate that thinking and that thought. And they've come up with stuff that we probably would never have thought for them to do as well. So how do we do some of this? We do it in two main ways and a sort of a third, really. We run national cohorts where teams come along online. We do in-person programs, and we've done lots of these down in Solent and worked with Anita, which has just been fantastic, with amazing teams across Solent Healthcare. And we also have a version which is just one as an away day. To be honest, to take the full QI approach, you need to do either 5 half days or 3 in-person days. Our 5 online workshops we've run over about 5 months, and we work with the teams, we give them a coach. What's lovely about this, it allows teams from across the NHS to really network, from very different organizations, acute care community, laboratories, ambulance services, mental health teams, primary care teams. We've had them all, really. And actually what's interesting is the challenges across all those areas are broadly the same in this space. Everyone always thinks everyone's got it better or worse than them, but generally what's nice about this bringing people together, we go, actually, there's a lot of commonalities here. So that's the online version. if I'm not allowed a favorite, but if I had a favorite, this in person is absolutely, this is 3 one-day workshops, again spread out probably over 3 months. And we have some really fun, lively sessions where we go through with teams. So teams come along to this, and Solent really, help model the way on this. And we have 5 or 6 teams in a room working through this, on doing some of the work in person in those actual sessions in session, but also some homework in between, and just coming along and spending time together as a team works wonders as well. That really starts to bring them together, and that needs to be tailored to the organization and the team, and we can get that support. There's some pictures. You can see teams having ridiculous amounts of fun, which is great. So really, to wrap up, I think, I'm hoping a lot of you know quality improvement. This is a really simple and effective model. I think what's exciting is applying it to teams, to that happiness, to that well-being, and allowing teams to explore it. It's completely relevant and useful. People really get it and grasp it. So by way of my final reflections, and that's a real whistle-stop tour of what we get up to, I'm really happy to take questions or drop me an email if you want to talk more about it. To me, this is a great approach to apply quality improvement to staff experience, and it really does bear fruit and works well. Helps those teams explore what might work for them and make good solutions that are sustainable. Does land well. Got to hold your nerve with some of this, but it lands well. And even the skeptics who think it's like CBBS do get on board and generally enjoy it. And we're seeing observable, lasting impact in teams, and we're evaluating that as we go. And it's a simple approach to a really tricky problem. Lots of people are trying to tackle this. But again, it goes back to what we know from a quality improvement approach. Those closest to the problem are best placed to come up with a solution. And that's exactly what we're doing here. We're not telling teams what to do. We're saying, you know your team, you know what it's like, you know what it's like working in your difficult environment. So, take those approaches. And it's a nice, simple approach for a tricky problem. And, teams learn a QI approach, which hopefully they can go on to apply to other challenges. So that's me done. Anita, I don't know if you wanted to say anything. You've been integral to our happy working lives down in Solent.
Yeah, I'd just say that it's really been embraced by the teams that have gone on the program. There was that skepticism, and there still is with some of the teams, but actually that's been completely turned around by the end of the 3 days. And just to echo some of the things Rob said, people that eat together, form good teams. And one of our AHP teams who are on the program, they've actually changed their clinic time so that they all have lunch together. I mean, obviously sometimes clinics run over and whatever, but the fact that they've changed those times so that they're all off at the same time is something really simple, but but they felt really empowered to be able to make that change. One of the others, in another area, they do an employee of the month, and obviously people are nominated by their colleagues. And if there's a few, then they get put up and people get to nominate for who the winner is, and actually they get back the gift of time. So it's half an hour. They can either come in late or they can go home early, but the impact that has made to the staff working in that service has been absolutely phenomenal, just by giving someone half an hour. So I would say, yeah, small little changes can really make a big impact, and really create that positive team dynamic going forward.
Brilliant. Thanks.
Rob, oh,
Oh,
you might have just seen it. I was just going to say there is a question in the chat, Rob, from Rachel Haycock. Do you work with NHS Wales, or is it just NHS England?
we'll work wherever, really. Really happy to have a chat. So we tend to be funded directly from our members. So I don't think we have any in Wales at the moment, but we'd love to have that conversation, or just super happy to share the approach that we're taking, Rachel, if that's helpful.
That's
So
brilliant. We'll be in touch. Thank you.
excellent, lovely, thank you. So hopefully that's been helpful, interesting, or added some value to your day. Really happy to take any questions, or please do check out our website or drop us an email. I think it's a really exciting space in terms of quality improvement, and a really, really worthwhile one. I go back to this isn't fluffy stuff. Getting well-being and happiness right really does pay dividends, and in productivity and safety and all those things. So hopefully that's been useful, interesting, and helpful. Thanks for joining us, and we'll get that recording on the website. And have a great rest of QI week. I might see you Wednesday. We're doing a quiz on Wednesday with prizes. Come along and win some prizes.